Hello, everyone, and welcome to the Campaign for Niche, making higher quality care for geriatric patients a reality. Thanks for joining us. The purpose of this webinar is not to convince you of the need to improve care for older adults. That would be preaching to the choir. I know you're convinced, and that's why you're here. What I hope to do today is provide you with some facts and framed responses that our niche colleagues across the country have used to gain and sustain support for their niche program. Understanding how niche addresses the needs of the organization and communicating these needs to other stakeholders throughout the hospital is the first step in implementing a system-wide program to improve care for older adults. We know that building, sustaining, and growing a niche program requires the buy-in of the governing body and staff at all levels. Different stakeholders view quality through their own lenses. There are, of course, concerns related to financial liability, marketability, staff satisfaction, and retention, and positive patient outcomes. Often various stakeholders share all of these concerns, or they may be focused on one aspect of the organizational needs. I'd like to introduce you to Eugenia During, a manager at Spotsylvania Hospital, who is speaking to us from the point of view of an early niche implementer.
My name is Eugenia During. I'm a senior leader for Med-Surg Oncology Unit from Spotsylvania Regional Medical Center. Through our orientation, we have introduced the niche program into our curriculum. Our first orientation was April 12th, so they've all heard about the niche program. We will have about 400 to 450 employees to start, and they will all hear about the niche program to understand that this is not just one person, it is about the whole team working towards caring for the older population. We have started to build competencies, setting up the ACE unit, and planting the seed for our GRE nurses. So we're right on the right path and very excited about being a member of the niche community. It's the right thing to do. It's just doing what is right.
Eugenia makes the excellent point that niche is not a one-person venture or even a two-person venture, but a team effort coordinated by a core group of leaders. Notice that prior to implementing the geriatric resource nurse model, even prior to attending the leadership training program, she educated the hospital community about the goals and components of niche. Niche sites often use flyers, posters, internet messaging to let others know that the hospital is on a serious journey, the niche journey to improve care for older people. Key in the messaging: older adults have specialized needs, and there is a commitment to bring best practices to the bedside. Of course, this message is underscored with the facts. Older adults comprise the largest number of consumers of hospital services, and this number will only increase, especially the number of the very old, those who are also at risk for the most complications. So after the messaging, and messaging the need, of course, is a description of niche. First, emphasizing the mission. The critical mission of improving care by using evidence-based practice at the bedside, and also improving the hospital experience for patients, for families, and those that deliver care for older adults. It's also concerned with improving the practice environment for the clinical team by providing the patients and staff with the tools they need to be more autonomous, that is, more directive of the care. It is also concerned with supporting interdisciplinary care and access to resources. And finally, niche provides resource tools to measure outcomes. The resources for startup include a planning and implementation guide which provides project management tools, a leadership training program which arms the team with the tools they need for startup, and the Geriatric Institutional Assessment Profile, which provides an assessment of staff knowledge, attitudes, and perceptions of the care environment. This enables the hospital to assess their readiness to improve care for older adults. Additional resources include a core curriculum for all different nurses at all levels and other disciplines, webinars, conferences, and access to our Knowledge Center. clinical protocols, organizational tools to improve quality, including certification and mentorship programs. Also, our sites have access to opportunities to network through discussion boards and online discussion. There's also benchmarked data and more. I'd like to next introduce you to Kim Shields, who is a niche coordinator at Abington Memorial Hospital. Kim talks about the highest priority Abington places on evidence-based care.
Hi, I'm Kim Shields. I'm the niche coordinator at Abington Memorial Hospital, and every year we look so forward to attending the niche conference. We see the conference as a catalyst for change. We leave here infused with excitement and energy to provide change to our geriatric patients, but more importantly, we utilize the research and the best evidence that we get from here to develop our strategic plan for those patients that we love so much, our geriatric patients.
Note that Kim emphasizes the value of ongoing access to educational resources. In addition, the collaboration that occurs between niche sites on listserv, discussion boards, and regional work groups is critical to sustaining quality. Of course, the question from all types of stakeholders is, what about the outcomes? It is important to understand the hot-button issues in the organization as perceived by all stakeholders: staff, patient and family, administration, and board members. It is important to understand the clinical priorities, the satisfaction profile of the organization, and the staff perception of care and cost. Niche hospitals report improved clinical outcomes. They also describe improved patient satisfaction. Equally important are reports of improved nursing job satisfaction. Niche hospitals also describe reduced costs associated with hospital care. So, in summary, niche hospitals report that the value exceeds the cost of implementation. I'd like to next introduce Kathy Roscoe Herbert, who is the system-wide niche coordinator for University Hospitals in Cleveland. Let's listen to Kathy and what she describes as the value of embedding niche.
I'm Kathy Roscoe Herbert. I am the coordinator for senior services for University Hospitals Case Medical Center in Cleveland, Ohio. I also am the system-wide coordinator for the niche program. And one of my great joys is that I get to implement a program that I sincerely believe will educate nurses, bring nurses to the table as advocates for older adults, and provide a stronger voice in the overall management of older adults. I certainly look forward to the opportunity for nurses to continue to grow and feel stronger in the design and implementation of older adult care. One of the most profound statements that I've received as I recruited champions for this project is a young woman who's been a nurse about 5 years. And as I indicated, some of the statistical data regarding the lack of geriatric prepared providers, nurses and physicians, she commented to me that, in fact, she actually felt deficient in her working knowledge as a provider of services for older adults. She, in fact, said that she thought that her nursing program did not provide comprehensive education in geriatrics. And in fact, most profoundly, she stated, sometimes I actually feel like I'm doing a disservice to older people because I don't really know what to do for them. And so for me, I take that as my poster statement. It's worthy of all of my efforts on any day to give all that I have, to gain more to give her, to assist her on this mission to be ready to meet the needs of older people.
Now, Kathy's message is compelling in that it emphasizes that niche focuses on supporting the practice environment of nurses, as well as their professionalism, and aligning those needs with the patient's needs. We talked about the need to recognize and share information that older adults are major consumers, and that niche is a targeted intervention with positive outcomes. However, this information is not always enough. We need to acknowledge and address that other potential perceptions of the entire community are important, perceptions that can impede and slow down your efforts to implement niche. Some of the things that people may say are that we have too many things to do, too many competing initiatives, we don't have enough money, or you may be dealing with attitudes such as older adults aren't our most attractive consumers. So let's address the perception of competing initiatives. Many niche sites in their infancy stages are developing new programs, comprehensive stroke programs, outpatient safety programs, for example. Or they may be immersed in another initiative, such as magnet recognition. It's important to recognize and point out that these initiatives and programs are all concerned with the care of older adults, and that there are opportunities to strengthen these initiatives through niche. A frequent concern is related to cost. The question is posed, can we afford niche? The response is simple. When we quantify the resources, some of which are extra and immeasurable, niche more than pays for itself. Finally, there can be a lack of understanding of the benefits of targeting the needs of older adults. We need to enlighten our colleagues at all levels that caring for older adults has significant intellectual outcomes and can be personally fulfilling. I'd like to introduce you to Mike Tarmy of Northeast Health System. Mike is a nurse executive who articulates this concept.
My name is Michael Tommy, and I'm from Northeast Hospitals, which is in the northeast corner of Massachusetts. The GRN curriculum has really taught us a lot about our nurses, and what we've done is about 3 months after our first GRN curriculum went forward, we gathered the group of nurses who had successfully completed the program to do a focus group. And we asked one of the nurses why they had chosen to come to the program, and she had a really great answer. She said that when she was admitting older folks to her unit, she didn't like it prior to taking the training. So she decided to come to the training because she wanted to find out whether or not she needed more training and education, or in her words, didn't know what she was doing, or did she not just like old people. Her answer was very loud and clear after taking the GRN training. She said that she really liked old people, and it was the training that really helped her come to that moment.
Mike emphasizes that knowledge is critical. He gives us the message that supporting staff's ability to care for older adults, have relationships with them, and feel good about their work is critical in his efforts to improve the care of older adults, as well as improve the work experience for his employees. This is also true for non-direct care providers, including administration. Often it is the chief executive officer of an organization, a key decision maker who may be caring for an older family member and who recognizes that we really need to improve care for older adults in order to be satisfied in our work, and also for the family members who can contribute to improving the quality of those they love. We know from experience that advanced practice nurses, other clinicians, and managers are also focused on improving processes of care. In other words, doing the right thing across the hospital system. Our message states that niche training, protocols, and organizational strategies are associated with improved interdisciplinary processes, including compliance with regulations, Joint Commission standards, and application of evidence-based protocols. We also know that this can improve our opportunity to include family members and care provision. Bedside nurses report increased knowledge and attitude toward older adults. Administrators are pleased with organizational outcomes, including decreased length of stays, decreased remission rates, and the avoidance of costly never events. At the foundation are improved outcomes with the geriatric resource nurse model. Geriatric resource nurses are homegrown experts in the care of older adults. These are the bedside nurses who are trained as peer consultants and experts and coordinators of care. These GRNs are also engaged in quality improvement activities, as well as training the geriatric patient care associates. The most successful GRNs are those who are passionate about care of older adults, and their success stories and their enthusiasm are contagious. Another important stakeholder is the long-term care facility. A long-term care facility that may be affiliated with a hospital or may be a freestanding entity. Niche hospitals that have nursing homes and/or assisted living often collaborate to improve care of the older adult across the continuum. In addition, our long-term care affiliates find niche tools, resources, and products to be valuable resources for their staff. Finally, all stakeholders are concerned with improving clinical outcomes. Niche hospitals report decreased incidence and severity of delirium, less pain, less incontinence, improved functional mobility, as well as other improved clinical outcomes. Equally important, the patients report that the hospital experience is more positive. I'd like to introduce you to our last niche site representative, Irene Peters. Irene is a clinical nurse specialist from Overlake Hospital in Washington State.
I'm Irene Peters, and I'm the Geriatric Clinical Nurse Specialist at Overlake Hospital in Bellevue, Washington. Last year I brought a nurse with me that had been trained in the Geriatric Resource Nurse Seminar that I do and was a GRN. She's a nurse on an orthopedic unit, and it had to do with delirium in that patient population, especially fractured hips. Their health grade scores came in a little low around morbidity because of delirium. And from what she learned here and what she learned in the GRN seminar, she then took to her quality committee on her unit and talked them into a project of implementing CAM. They've changed their physician orders, they've got the surgeons on board, they have hospitalists involved now with that patient population. They went to the ER and have the ER doing CAM, and the pre-admit area in surgical doing CAM, and it's just phenomenal.
Irene's description of Overlake's GRN program is compelling. She has described how a nurse, properly armed with knowledge and supported by the administration, can implement change on her own unit, as well as other departments and within other disciplines across the hospital setting. So these improved outcomes mean better staff satisfaction, lower patient stress levels, better satisfaction for patients and families, and a general consensus that the patient is in good hands. Patients feel cared for and cared about. So thank you for joining us today, and thank you for your commitment to the care of older adults. I'd also like to thank our niche site representatives who appeared on this webinar today. We hope this has been useful in giving you some information as well as some method to gain support for your niche startup.